It is a huge honor today to be interviewing this fine group of people on probably one of the most important topics there is in dentistry. I mean, I know, Dr. Andy Mancini, you're a pediatric dentist, but people don't die from a filling or a crown or a root canal. It seems like if anyone ever dies in the office, they have an IV in their arm. They're under sedation. And you guys are talking about the most serious aspect of dentistry.
Well, you'll be surprised, Howard, that it's not just with IV or sedation. Actually, we have a lot of statistics, a lot of studies that people die and they have fatalities even just on their own without any sedation. So we have patients here, even pediatrics, that they had a cold, and one child one time choked in the loogie and was starting to have some issues. And we see other researchers, we have a lot of patients out there that they have ADHD, they have anxiety, depression, and you name it. They are taking a lot of medications and add some sort of issues about anxiety in the office, in the dental office. And the heart just keeps pumping, beating so fast that it does trigger a lot of issues that we've seen, a lot of 911 calls out there being summoned. So it's unfortunately not just on the sedation. So that's where we're trying to change the mindset there. It can be happening to anyone, anywhere.
So I really applaud your mission statement. Anxiety is one of the biggest issues in dentistry. I think the two things that keep people away from the dentist are fear and money. And you guys are trying to address fear, and I really applaud your mission. So how did this mission come about? How did you get into this?
Well, so I've been doing a lot of pediatrics work sedation for a few years now. And the mindset we have in the office, we take the whole team when you're going to be doing some of those courses, because some state requirements, you are required to have some CEs, the continuing education. And unlikely, most of the offices, we have this staff coming along, because if I'm learning something, I want this staff to learn the same thing that I'm learning. We just have different roles in here in this office, but we're all part of a big, wheel that comes together. And when in those courses, I've noticed they were doing very exclusive, very segregated. So assistants, they don't have access to every course. Or when they do, they stay in a different room than the doctors. And it's a different sort of a lecture. And the lectures they have for the doctors, they shuffle the doctors together, like 4, 5, 6 doctors. Some lectures, even 10 doctors together for the simulation. And what happened is, it's just nature. People, one going to be an alpha dog, and the other is going to be watching. And sometimes they don't want to say anything to not sound stupid in front of a colleague. And they go, they do the network, which is great. They learn some new things, which is wonderful. But once it comes to reach that full potential in the course that they have out there, it's not happening. They are having that limitation because peer pressure in one way, or they don't have that nature to be the alpha dog, to be hands-on and to be taking the lead. But they are doing work in their office. Then they are the alpha dogs in their office. And when an emergency happens, they're not going to call Dr. Smith, Dr. Joe, Dr. John, that is their best friends who are in the course with them. They're going to be looking to the assistants. They're going to be looking to the front office. And they're going to be looking back to the doctor. And that's when the problem arises. And in our course, we just decided to be doing differently. It was so interesting because one course that was being provided by a very strong group, I was begging them. I was like, I even paid the fees for the assistants as doctors so we can do the simulation. All just our office. No can do. They have to be doctors. So apparently being a doctor is a big deal. So I'm even going to get a bigger 5-gallon hat because it's getting bigger for that. But what keeps everybody humble is when it happens an emergency, then we have to get a very cohesive team to be coming together. And we had one time an emergency here, but we are prepared. And it was not on a sedation. It was that actually kid that I mentioned about the loogie. And he had a laryngospasm. He just couldn't breathe. Just like that, the child became purple. And just like that, we got the child back in the natural color that he had.
Isn't that how Joan Rivers went with the laryngospasm? The famous Joan Rivers?
You are correct. So she had an issue and was in a procedure center. and they just decided to be using a different set of anesthesia and tickling with her vocal cords. She's no longer here with us. So it happens. That's what I'm saying. People are prepared in a way that once it needs to be coming, that conclusion of emergency, they are not. And our goal should be just like the air pilots. It's like that deja vu where you have a lot of assimilation. And our simulation is not just those dummies for CPR. It is the hands-on, like the mannequin. I refuse to call our simulator a dummy because, one, that thing is probably smarter than I am. It answers, you can interact in a way that it just blows your mind away. You can have that sense of reality, and then you can understand how important you have those courses on a frequent basis, because other studies mention that within 4 months you lose 60% of any data acquired from anything, from CPR, ACLS, and you name it. So, but again, back to the main principle of the office that created that course was to have the whole team learning the emergency. Because again, when they all have a simplified plan, no one gets in each other's way, no one panics, and everybody can just get the best outcome for the patient. So, and if not, we know how to recognize and have the appropriate care, like the paramedics coming and doing the best they can do. But notice that most of the fatalities happens for lack of recognition of the emergencies. The last one he had, that it was a fatality led to death. They took over 26 minutes to recognize the patient was having some distress. So 26 minutes, it's a lot of time. So, and you talk about here that within 60 seconds already makes a difference. Imagine 26 minutes. So, and again, we try to take the alpha dog, get the whole team, all interacted, all having that hands-on simulation. We have Q&A after the simulation just for that one office, which is just not done by any other course. And the reason they can't do it, logistics. They cannot put their 500 doctors to be done one-on-one. They have to shuffle everybody together. And we're here to go in a different area. We're going one-on-one with each office because our main goal is to save lives.
So do you go to the office or do they go see you in Minnesota?
No, we travel all over the country. It's just like a rock band. So, and we go Seattle, San Francisco, Vegas, Dallas, like we go to major cities, and then we have the offices of those cities just meeting us in a ballroom or hotel. And that has an advantage because they don't have to shut down production. They don't have to be far away, like, 4 hours in an airplane, 3 hours in an airplane. They drive 30 minutes, 40 minutes. Maybe some drive maybe an hour and a half. And they have the course. They go back to their hometown or to their places, and that's it. Just business as usual.
And how long is this course?
So the course is divided in 2 days because we have also the IV sedation portion of it. We just remind some of the folks how to watch for the IV sedation, all the tricks, all the hiccups, all the pitfalls, and that's done on a Saturday. And the main simulation and lecture happens on a Friday. So it's an all-day course.
And you do it just for one office at a time?
No, correct. When you do the simulation, it's one office at a time. When you're having the lectures, we have a minimized group of offices. We can have them in the whole group, but we still have that one-on-one feel.
And how much is that course?
So it's $2,500, and that includes 1 doctor and 2 assistants, because it's almost like 27 CEs for like $800, $900 if you sort of divide it for 3. And you also have to think you're not having traveling expenses, you're not having hotel to be sleeping in, you're not having parking, all of that stuff that you have in the airport and whatnot. So
I think you should put a teaser 1 hour of your seminar on Dentaltown. We put up 350 courses on Dentaltown. They've been viewed over 500,000 times. I think you could disintermediate this by putting up the lecture part on Dentaltown so that they would all be turned on to you guys, your systems, your techniques. And I think that'd be almost like a marketing program for you. You would be educating while simultaneously marketing.
Well, that's one thing you can consider, and definitely put it together to have something that the teaser, as you're calling. We definitely have the know-how to be doing that. But I think you can even do something even better now. So if someone call us, may mention that they listen to your podcast, we can grant them a couple of things. We can have the IV portion of no charge, and that's $1,000 costs, or we can grant them a 20% off the ticket. So instead of it being $2,500, they can have that for $2,000, and includes one doctor and two assistants. So.
And what
Yeah.
do you exactly try to teach them in 2 days? I mean, what would they be going back to do?
Well,
What should they be able to learn and go back and implement on their office on Monday?
So, one, you're going to be surprised, like even of the offices we have taught around the country so far, how they lack a plan of emergency. They believe they have something in action, but they don't. Once you have their hands on it, place them on the fire, you see how they don't have that elaborated. And you want to make it as simple as can be. Two, we just review the whole medical protocol. They have to be selecting a case, during the case, and after. Three, for emergencies, not even during sedation. And you see the most common outcome of emergencies, they'll be prepared to be handling that. Then you have specific 2 to 3 simulations that is done and changes year after year. So some attendee that went for 2015, when you're back in 2016, you're going to be different simulations. So unless if you repeat one or so by popular demand, but we just always rotate and keep it fresh. So they're going to be learning also about the changes in the guidelines that happens across the country. We have a big vote now is going to be putting in November that's going to be affecting a lot of folks that they do sedation, and a lot of them don't know that. So we have a full-time staff just dedicated to look all changes in protocols and requirements. So it's a lot of a thing that is just more than just pumping CPR on a dummy. So they learn, again, how to be thinking as a team, how to communicate well. So if you make an analogy, is like the Hell's Kitchen when they have to communicate, but without the cursing, all of that drama, but just to get interact on a team basis. So that's where they're going to be learning or enhancing their skills.
And do you teach oral sedation or conscious sedation or twilight sleep or deep sedation? Talk about all those different terms.
So oral sedation became now conscious sedation because it's done just by mouth, or you can have by nose when you just spray in for some of the nose. We also mention and teach about IV sedation. Some offices they have that know-how capability, and you have our full-time staff that talks about that. And the IVs address mostly on a Saturday day. So, and again, we talk about the pitfalls, what you look after, what you look up to, and how to maybe enhance some of the shortcuts. And they'll be surprised how they leave the course saying, oh, I was never aware I could have done that. And they always do in a way that takes longer instead of having them in a faster and better way without shortcuts. We don't cut corners and no shortcuts, but just have more efficient ways to be doing the procedures.
And what is your favorite oral sedations?
Well, we use here a cocktail of those. We go from Versed, Demerol, Vistaril, even chlorohydrates. And a lot of folks are going to be thinking, oh, chlorohydrates have been discontinued. And actually, it has a way that you can have your hands on chlorohydrates still. And you teach that in the course. So it has a lot of things that we really help how they to make the selection of the drug. So it doesn't have one size fits all. So it goes again, what procedure they're doing, the age, weight, and the length. So it's a lot of moving parts that we just get the provider to be thinking much quicker how to make that selection. So.
And what about IV sedation?
Well, IV, I can let Julie just have a taste into it because she's one of our experts that mentioned about IV. So Julie, if you want to jump in.
Okay. Well, I teach the Saturday course on the IV skills and training, and this portion of the course is kind of a complement to the emergency portion. It's really beneficial because it takes a person, looking at, all the different things that you have to address with IVs. So the course is really inclusive for a beginner or an advanced practitioner. It really can cover anyone, and that's what's really unique about working with really small groups, is that you can find out how they practice, you can cater the course to their needs, and give them that ability to learn new content, ask questions while you're teaching, And then lastly, have that hands-on time. That one-on-one time is so valuable.
Or, of course, they have the hands-on, which makes a huge difference. Not just a slide there talking, they have the hands-on as well.
And your website is sedationready.com.
Correct.
And Julie Wilcox, do you do the sedations for Andy in his pediatric dental office?
I am a CRNA, but he has not done IV sedation in the office as of yet.
Yeah, we chose not to go in that route and just have a choice. So other offices they do. And we don't cater just for pediatric dentists. We have periodontists, or general dentists, so they place implants, obviously adult population. So it's just a preference of how each office responds. But we're going to cater because, again, the course is not about just sedation. It's a course about emergencies. So how to recognize, how to be prepared, and how to summon any help or your team. That's the main thing.
Some of these cases that have been all over social media this year, you're reading the stories and they're just like crazy. Like they left them setting up in the chair with their head forward while the dentist went down the hall for 10 minutes looking for other physicians in the building. I mean, just
wow,
just batshit crazy. I mean, they not even maintaining an airway. I mean, it's just there is a huge need for this. This is why I was super excited to get you guys to come on today. I mean, just the simple things like just if something's going wrong, just making sure they're maintaining airway.
Absolutely, and that's just the basic, being able to handle an airway is kind of where, some of my expertise comes into, because I've been in anesthesia for over 20 years, and so it's really wonderful to have someone build that confidence that they can actually take care of someone's airway and manage it.
And have seen, like in the studies mentioned, that even some folks, again, having cleanings in their office, but when you see the medical history, they having a lot of medications they take. I'm not talking about just, sedatives or anything, and they end up having issues that obviously the hygienist or the assistant will not be able to maybe identify at first because you're not going to the right course. And when you have the doctor to jump in, you have to get everybody just so quickly ready. So again, that only doesn't happen in sedation. It happens anytime, anywhere. They can happen in your hallway. They can happen when you leave your office. So they just collapse outside. So who's going to be responsible for that? And you're even coming with something on top of that that's going to be released very soon, that we're going to be talking in our courses how to be dealing with the HIPAA, how to get to protect their systems when you have to be sharing notes with paramedics or hospital, which no course addresses that, not a single one. And I know because I've been to those courses, I attend those courses, they don't talk about that either. So we have to be thinking several things that we thought, and we're just making simplified for all the attendees. So I'll let them continue, Howard. I know it's a long portion to be mentioning. I have a patient they're going to be seeing, not a sedation. And I just want to stress them, because you mentioned about your teaser, and I'll follow up on that. But for all your viewers that they mentioned that they saw in the podcast, because you only have for 2015 4 dates available left. Everything else been sold out. One is in Dallas, one is in Phoenix, one is in Miami, and the other one, it's in Atlanta. These are the last 4 for the 2015. And if they mention your podcast and they call the office, we grant them 2 ways, or 20% off. It'd be a $2,000 deal instead of $2,500, or they have the IV course portion that to be waived. That's $1,000 value on that. So they can make a choice, but they have to mention you. So
before you leave, I got to ask you. I've lectured in Italy before. How did you leave Italy and go to Minnesota? I mean, what went wrong in your decision making? It had to be love. Did a woman attract you to make that decision?
I can tell you, making that move to Minnesota, I found joy in my life. So, and that was the best thing ever.
Oh, is it the one behind her? Which one? The one behind her? Okay. Well, that explains it, because if I wasn't seeing her right now, nothing else would explain moving from Italy to Minnesota. And I know that because my sister is a cloistered Carmelite monk in Lake Elmo, Minnesota. So I go up there all the time. And what's funny is sometimes when I go visit her, I drop 100 degrees. I've left here when it was 88 and got there and it was like minus 12, and it's like unbelievable. But I think she likes it, but I I would take Italy or Phoenix any day over minus 12.
That's okay. I always go back to visit, so Italy's always been there, you know.
What's your
But,
favorite city in Italy?
well, I'm biased because I was born in Florence, so
Okay.
then Florence is the favorite city, though.
Yeah. I like Rome and Venice are amazing.
My mom, she's from Rome, and Venice, yeah, it's a. I was going to propose to her in Venice, but change of plans, propose here in Minnesota anyway, so.
So do you cook her lasagna and Italian food and all these fancy Italian dishes every day?
Well, you name it. Have to come and have to, I mean, try our dishes here. So, yeah.
All right, so now, Julie, you're going to take over now.
I guess so.
And
And
is it-
it'll be just compliment. It's a whole team effort here.
All
So,
right. Well, and thank you for your time and congratulations on your mission.
Prego. Ciao, ciao.
Ciao, ciao.
I really, really enjoy teaching the course. You are just surprised all the time at the various levels of knowledge. I mean, it can be as simple as someone, laying a stethoscope on the chest and listening to the heart sound for the first time. I mean, to be able to recognize a murmur or just be able to put in an oral airway or just, to be able to actually not only visually be a part of it, but to have that tactile part too. And the sim models are really neat. They do everything. They even talk back at you. So you got to be careful with what you say. But no, they're really unique. And the IV portion of it, there's actually a sim model arm off our pediatric sim model, which is really nice because it doesn't give away all of the venipuncture areas, but it actually allows the person to be able to actually have that hands-on time. So it's really fun. You're able to set up, prepare, plan ahead, and that's really where the safety comes in, because once you're able to kind of go through a scenario, hang the IV solution, people don't even think about IV solution too much, and what actually it's made out of is actually a medication. So if you're hanging something with D5W, it has actually sugar in it. Or if you're hanging a bag that's a colloid, it might be changing the makeup within the vascular system and pulling fluids towards it to increase blood pressure. So there's just a lot of different things to discuss to just broaden people's alertness to what they're doing with the IV, and then actually being able to handle it, puncturing the bag, spiking it, priming the tubing, and most importantly, being able to actually start an IV isn't as easy as it sounds. Because just like Dr. Mancini said, our average patient population now is adult population, and kids too, are a little bit more overweight. They have more medications on board, and they just have more going on, and people are living longer. So having that chance to ask questions while you're actually trying to attempt a brand new skill is pretty unique. So.
It seems like a lot, I have a lot of friends that have always done IV sedation. It seems like, obviously you either do it or you don't, but it seems like the ones who do it and have been doing it forever, they always have much larger practices, because I think that fear is a major issue. I think dentists always think about price. They always think about insurance. Should I take this PPO, whatever. But there's just a lot of people where fear is, and fear is hugely irrational. They might come in with 20 body piercings and 10 tattoos, but can't have a shot. And you're like, dude,
right.
you have your sleeve. How many shots was on your sleeving? And you got your ear pierced 9 times and a bone through your nose, but you're not going to let me give you a shot. So fear is just hugely irrational, and it seems to be a big game changer in the practices that do it. And so Sedation Ready, you feel you can go in there and get them up to speed on a weekend?
No, we're not all about covering everything in a weekend. It takes a lot more time than just one course to be an expert at something. It's lifelong learning. So what I do in my portion of the course is just get the foundation established, getting people the ability to anticipate something coming, being able to actually assist the doctor at the time of an emergency, instead of actually just for the very first time handling, a bottle of medication and not knowing the dose and not having injected air and drawn out medicine, or where the IV supplies are, what size you should grab, all of those things. Being prepared ahead of time is huge. So I definitely don't feel that anyone is ready to give IV sedation in a weekend. That's just my opinion.
So I guess the important thing to know about with our course is it isn't about, it is definitely about the emergency and how to handle the emergency, but 90% of emergencies actually should have never happened if the person would have realized the steps that are happening to actually calling 911, the EMTs or paramedics arriving. So it's how do you mitigate those risks that you have when you're doing a procedure or you're having people walk into your office with high anxiety. I mean, Dr. Mancini starts his lecture with the statistics of the number one fear is public speaking, the second fear is going to the dentist. So, and then I think the third is death. So people actually are scared of speaking in public and being a dentist than they are of death. So it's being aware as a provider and your assistants being aware that at the minute someone walks into your practice, you're evaluating them. You're evaluating their level of anxiety. You're evaluating their physical appearance. You're making sure that your protocols include understanding what other factors may cause issues, such as diabetes or medications that they're on or whatever. Obviously, with our population of kids, there's not quite as much medications that may cause risk factors, but it's really that whole process of all the way from the person walking into the door through the procedure, avoiding that medical emergency, and then having appropriate care after they leave your practice. And it's really being able to identify that, because even while, for us, we use, a pulse ox, and Dr. Mancini has a stethoscope that he has, and I think he puts it, where does
it's a precordial stethoscope.
Throughout sedation, and
the right here where you can listen to lung sounds and heart sounds at the same time while you have your hands free. So, and it's attached to a little earpiece that you have molded from an ear company, so you can listen to your patient the whole time you're working and be in tune to their hemodynamics, their blood pressure. You can tell a lot by that. And anesthesia uses that all the time.
Yeah, so it's knowing your instruments, but also knowing the shortfalls of your instruments because of the travel time for oxygenation.
Oxygenation. That's a mouthful.
Yeah, of the blood, and so all that kind of stuff. So it's talking through that whole process, and then what's great with both Dr. Mancini and Julie is the level of experience that they've had. I mean, Julie's had 20 plus years of experience from being on crash teams and actually having medical emergencies in the hospital to running her own anesthesiology practice. And so the people that are providing the information are highly educated, highly skilled, hands-on experience, and then imparting that knowledge not just by speaking it, but also guiding them through the process. So we have the 2 days of both lecture and hands-on, and then in addition to that, we have the practices evaluate their office protocols from patient intake through patient procedures, and then also their medical emergencies. Julie then, or the team, evaluates it, and then after the seminar, we do a call to really go through in detail what they've done, so they get that practical takeaway to really get to the point where their office is not going to be in the news, and their office is going to be, instead of being the let's cross our fingers nothing happens, they feel completely comfortable that they're covered. And really what we're hoping that this will become as we continue to grow is it'll be an annual thing that people come back to, because like Dr. Mancini was saying, that knowledge attrition, 60% of knowledge is gone after 4 months. So coming back and reevaluating and learning new things. I think they've changed the CPR courses every year. They have some new change in CPR. And so it's really making it a repetition so that it happens, you get that rush of adrenaline, but it doesn't wipe away all of your knowledge.
So we actually include a full year of follow-up with everyone who attends the course. They can reach out by phone or email, and we get back to them. We actually answer their questions, and if they've got something coming up, they have a concern, they can reach out and give us a call, and we'll be there for them. So that's really unique, is that follow-up portion that you're talking about, Joy. We also keep it really fun and light, and so that as a team, people are able to communicate freely and they're not intimidated. Keeping it simple, the simple principle, or, that type of thing is really important with medical things, because that communication may not be there, it may not exist, because there might be that hierarchy. So when you have the assistants and the hygienist and the dentist all coming together and doing this workshop together, this course and this hands-on portion, that's where you really get to see that unique dynamics within the team.
So you live in Hudson, Wisconsin, and the other two, Mrs. Mancini, and you live in where in Minnesota?
I live in Cottage Grove.
Is that a suburb of Minneapolis?
St. Paul.
Okay, St. Paul.
Yeah. Mm-hmm.
And Joy is in Hudson, and I'm in Baraboo.
Is your last name Mancini now?
Not yet.
Oh, not yet. Okay, no, I'm sorry. I jumped the gun there.
Very soon.
Yeah, right around the corner.
Delay it as long as you can, because the minute he gets the legal contract, he'll stop cooking for you. And you're in Wisconsin, and that is close to Minneapolis, right?
Actually, we're in a suburb. Our home is in a suburb of Minneapolis too. We live in Woodbury, so the office is in Hudson. So everybody
Wisconsin.
Practices out of Hudson, Wisconsin.
Mm-hmm.
But it's literally 30 minutes outside of St. Paul.
And what made you guys get into this?
The sedation course.
It's the Sedation Ready, yes.
So it goes back to Dr. Mancini's frustration of how the courses were provided by other CE courses. He has the philosophy of the team and really saying, who's going to be by my side when I experience a medical emergency or when I experience something where I need my team to step in. It's not going to be Dr. Jones or Dr. Smith or Dr. Whomever. It's going to be my team, and I need them to feel just as comfortable and just as experienced going through this. And so he reached out to a course and said, I just want my team to experience this with me. I want them in the room, hands-on with they had more of a CPR dummy. They didn't have the simulator that we had. And he said, I want them to have the same experience I did. And they said, no. They said, there's going to be other doctors in the room. We don't want to take away from the doctor's experience. And Dr. Mancini said, well, then I'll buy the room. And I want them to come. And they said, no, we won't do it. And he's like, well, what course will let me do this? And they said, no course will let you do it. And he said, well, then I'm making my own course. Because
I got thrown out of an endo course in San Diego. I won't say his name. He's one of the most famous endodontists in the world, but it's for endodontists only. So I think I was 27. So I checked out the box. I was an endodontist. I just didn't say anything. And he figured it out at 3:30. Only an hour and a half to go, and he made me leave.
Wow.
Oh, that's mean.
That's just silly. I don't understand
people
that
are great.
exclusivity.
So tell me, what do you recommend? Because we do have dental anesthesiologists in dentistry, and they've been trying to get specialty status for a long time. Do you think it's better that like a company like yours, Sedation Ready, prepares the team for everything, but for the actual IV, bring in a dental anesthesiologist, or do you think do you think that should be a core competency, specially focused, or do you think dentists can do the sedation and the procedure?
Are you talking? Do you understand the question?
Yeah, I
Okay,
do.
go ahead.
Really, even though there's, anytime you're doing, let's put it this way, the dentist has to be totally competent in what he's doing with that patient. And I actually, some people can do two things at once, but most people can't very well anyway. And I sure wouldn't want someone leaving the room while I was deeply sedated. I mean, you need somebody watching you and monitoring you very closely. And I feel that training is really important. So, you know, for most people and dentists, we're all in our own specialty. So it's important that once you reach that moderate to deep sedation, or even general, of course, I think it's important to have a nurse anesthetist or an anesthesiologist or somebody that's specialized, whether that be the dentist in anesthesia when they've actually had that course work, and is it appropriate for them to be in that role. Because what you find is everybody's scrambling. You've got, you know, one person doing the procedure, but who's really watching the patient? You know, that's kind of my feel on it. Safety is key, you know, so a lot of people aren't very good at multitasking, and
Because
it's a lot of liability. I mean, when
Right.
you're running the show, you're responsible for everyone that's caring for that patient, and you're supposed to be directly supervising those people. So you're taking on a lot of risk and liability. So it's not a good idea to be all about the money and be taking people that are anxious, because people pay anything. I mean, they're frightened. Everyone's scared of the dentist, even me. So there's a fine line. You have to really be a patient advocate, in that.
I always hear people say that public speaking is the biggest fear, but I've never been at a funeral and heard anyone say, well, at least he's not up there giving a speech.
Very true.
We're glad he's in a box and they're lowering him down into the ground. So would you say that you're more about getting the office ready for this whole thing, but if you were going to put them lights out, bring in a dental anesthesiologist?
Yeah, you need a professional for that. I mean, there's always exceptions to the rule. I mean, you might have someone very highly skilled dentist that's gone on to anesthesia training.
Well, I know this.
I think it's rare. I really think it's very rare.
I know this debate's been going on a lot around the world. I mean, I've heard this debate in the United States. I've heard it in the United Kingdom, where if you go into hospitals, they're not allowed to give the anesthesia and do the surgery. You can't do the bypass and run the IV. They break that out. But then when you go into dentistry, all day long, oral surgeons are doing the IV and doing the surgery.
Yeah.
So that's a red flag there. And some countries are saying no more.
It's very, very dangerous. Look at all those people that went to plastic surgeons, and remember the liposuction and how many people had died because of the tremendous fluid shifts within the body. And it's just, it's a real scary situation.
And for the record, a lot of people think I've had liposuction, and I have not. I have not. And I'm also not pregnant. And I wanted to spill those 2 months. So it's a red flag to me that in the physician world, you can't go in a hospital and run the IV and do the surgery. But then in a dental world, you do that. And I think dental anesthesiologists, I mean, I got out of school in 87, and it seems to be a rising trend, getting more and more popular. And I've also noticed some of the dental offices here in town Phoenix that where all they do on their SEO marketing on Google and their Facebook and Twitter is that they will put you to sleep, and they do it with a dental anesthesiologist. They have huge practices because they're always getting that patient that hasn't been to the dentist in 10, 20 years, and they always need multiple big treatment plans or root canals, fillings, crowns. I mean, they're just huge cases.
They're huge cases, but you have to remember that nurse anesthetist or anesthesiologist, they both can do that Just like in the
Explain
hospital.
to our viewers the difference between a nurse anesthetist, an anesthesiologist, a dental anesthesiologist.
Well, a nurse anesthetist first goes to nursing school and then specializes in anesthesia practice, which is usually 3 years of study. I went to school a long time ago, so for me it was 2 years and then a master's degree. Now the education is increasing. For an anesthesiologist, they are an actual medical doctor and then has gone into a specialty focus, which can be another 4 years in anesthesia. So they are a doctor of anesthesia. However, in the anesthesia world, both people perform the same exact jobs, except, one is a nurse anesthetist and one is an anesthesiologist.
And do you think they're both equal substitutes in the marketplace? I mean, do you think if a dentist has access to either one that you're good?
Absolutely. Yep. And then the main key is that the dentist has to make sure they have a qualified, credentialed anesthesia provider that has privileges at the hospital that they utilize. So if there is a crash, a person who goes down in the dental office, that dentist or the nurse anesthetist or dental anesthesiologist has to be able to have privileges at that hospital too. So you've already got that pre-set up, and that's part of the course too, is teaching people, what the requirements are and what's needed. I mean, a lot of dental practices are way out in the rural area, and they might be up steps. Maybe the paramedics wouldn't be able to get up, with a stretcher, or maybe they just don't have access, or it takes an extended period of time to get there. So, yeah, it broadens the mind to all of the considerations. Just like Joy was saying, I mean, from the minute the person comes in the door, you should be doing an airway assessment. Thinking about, wow, look at the person and use every minute that you have to make that plan safer. To be able to anticipate, because anesthesia, like they say in school, is 99% boredom, not really true, but 99% boredom, 1% sheer terror. So
You could say the same about pilots and marriage.
Thanks for that.
thank you.
So who's this person on the left here? She just we haven't heard from her yet. You have
Yeah.
beautiful teeth, by the way.
Thank you.
Yeah, perfect. Are those all natural, or is that braces and bleaching?
I did have braces, but no bleaching.
No, wow, those are incredibly straight and white teeth. So what do you do? What?
I do a lot of the marketing, advertising, sending out email blasts, stuff on the website.
She's the mastermind that's basically taken Dr. Mancini's dream and made it a reality.
I still think the best marketing you could do. I think it's what I call deconstructing the marketing deal. I tell this to people all the time. I think the days of I think going to these dentists and giving them an hour of him so that they get to see him, they get to hear him, they get to form a relationship. I think that's I think going from an email to I'm going to fly him down to my city is kind of a big jump. But I think when they sit there and see him and hear an hour of the lecture, then they've heard an hour, then they say, okay, I've listened for an hour, now I want to hear 2 days. So you kind of deconstruct the deal. It's a lot easier to get them to go from nothing to an hour, and then the same effort to go from an hour to 2 days instead of just going from, I just heard of this guy and now let's do 2 days.
Mm-hmm.
I think, and a lot of those consultants that put up like I know an endodontist who put an endo course on Dental Town, and he got booked for 76 speaking engagements.
Yeah, we want to be able to reach out to everybody. It's really important. Even all the anesthesia conferences that I've ever attended, they're all huge lecture halls with 300 to 500 people. So there isn't that quality time for questions and answers, and that's what's really, really unique about us with Sedation Ready.
Well, the reason I tried to get you guys on, and by the way, I have no connection with companies of my podcast listeners. You're talking about 7,000 us. They don't pay me to be on here. I don't pay them to be on here. There's no money changing hands. But the reason I wanted you guys on here is because it's been a bad year in social media
Mhm.
for dentists and anesthesia. I mean, the only thing that took the anesthesia deaths off the front lines was some dentist shooting a lion,
That was the
and
Renaissance.
and then another pediatric dentist, and then a hygienist hiring a hitman to kill her pediatric dentist. Did you hear that one?
No.
Yeah, so, yeah. A hygienist was jealous her boyfriend was dating a pediatric dentist, so she hired a guy to shoot him. And but before those two events, dentistry was in the news usually because someone died in there, and it usually had something to do with sedation. I mean, that's still a huge issue, and and all people only know what they know. They don't know what they don't know, and I agree completely with Andy, 1,000%. I've seen one of the, what are the common traits of successful people? When you go to a seminar and there's 300 people, it's always the left side of the room is 200 individuals, dentists that come by themselves. And then the right side of the room is the same size room, but it's one dentist who brought the whole row as their staff. And whenever you see the dentist who always takes the entire staff with him to the seminar, I mean, both assistants, the hygienist, both receptionists, and even their spouse, oh my God, those offices are twice as happy and healthy and functional and profitable and money. And then the guys on the left, it's just like they just don't get it. I mean, dentistry is not a dental event. I mean, it's a dentist, it's a receptionist, it's a hygienist, it's your spouse. It's a team culture, and the culture starts from the head down. The Italians say a fish rots from the head down. And if the head's not in the right place, the rest of it is all rotten. And so I totally applaud this entire team approach. Everybody has to be on board. I think from there's 9 specialties in the American Dental Association. One of them is public health, and the dental anesthesiologists are trying to get on there. And I almost think dental anesthesiologists is a form of public health because so many people don't get access to dental care because of fear. I mean, dentists are always the first to blame everything on money, but these Americans, they all have a car, they all have a cell phone, they all have a computer, they all have trips to Disneyland, they all eat out at fast foods. They buy $300 worth of they buy $300 worth of fast food, like even a happy hour. I mean, one drink you could have bought a 12-pack. You know what I mean? So Americans waste all their money, but there's just a lot of people with really bad teeth and a lot of oral systemic health issues just because they're afraid of the dentist.
Yeah.
And it just doesn't have to be that way.
I lost a friend who had a tooth abscess that did not get it treated. He didn't tell anyone. He was sick, became septic, and actually passed away. Yeah.
And I lost one patient from that too, and her name was Charity, and she was 5, and it was the saddest thing ever. And she had a toothache, and she needed to come in, and she didn't, and it went down into her throat, and she suffocated in the middle of the night. And I swear to God, her mother aged 10 years in a year. I mean, she just looked. I mean, I almost think it'd have been better if it would have killed the mom and left the baby. I mean, it just killed her. Her.
Oh, absolutely. Yeah, and that's what we don't want to have happen. I mean, kids, everyone's so precious, and each individual is truly unique.
Well, I want to thank you for all your time, and I want to thank you for coming on here today. I applaud your mission. I applaud the importance of what you're addressing. It's far more important than what bonding agent you should be using. I mean, this is the most critical stuff. And like I say, in some of those narratives that we've read from these fatalities, I mean, they didn't do anything right. They left them sitting up in a chair. The ambulance people are saying the chair was erect, the head was forward, and it's like, my God, and the doctor's running down the hall, and the assistant doesn't know what to do, and I mean, it's just crazy.
Disaster.
Yeah.
So I do. I hope if you're the marketing guru, I think you should put a course on Dental Town. Because it's very counterintuitive. Because how consultants make this mistake all the time. They say, well, if I get on Dental Town and I tell them what I know, then they're not going to hire me. And it's exactly the opposite. The dentist doesn't want to hire a consultant if he doesn't know how she thinks. He wants to know, how does this person think? And then when she says what she's going to do, the dentist says, that's a great idea. I know I'm never going to get it implemented, so I'm going to write a check and give it to you because I would love for you to get this implemented. So when the dentist watches that and says, wow, I like that, and I need my office on board, then they're going to call you and say, come on down and get my whole team involved. And then plus every dentist knows the most important thing you learn on continuing education is that your staff doesn't believe you because you're just, I'm from Kansas. I was born in a barn. I'm not the classiest, most cultural guy. I don't use enough deodorant or cologne. But when somebody comes in 100 miles away from home with a PowerPoint and a deal, that person is God. Yeah. And they, you take. That's why I take all of my staff with me, because if that person up there lecturing says it, they're all taking notes. And if I say it, they're all like, "Oh, that's just Howard." Someone throw him a cheeseburger and he'll shut up. So yeah. So deconstruct the sales process. Put the more information you put out there, the more of that course you give away, the more they're going to come and write a check and have implement it. But thank you, ladies, for your time.
Yes, thank you so much.
And I'm here in sunny Phoenix, Arizona. So if it ever gets too frozen cold up there and you think you're going to die, just come on down and visit me in Phoenix.
Sounds good. Thanks,
Thank you, Howard.
All right, and good luck on your courtship and your dating and your marriage. And what's his favorite Italian dish that he cooks?
Lasagna.
Yeah. And when I took my son Eric to I was lecturing in Venice, and I took my oldest boy Eric with me. And you just think that this is America, and there's lots of Italians that live here. So there's good Italian restaurants all over America, and you think, we have the best Italian food in America too, and we just don't.
We don't.
I mean, it's just not like Italy.
Different.
Yeah, it's completely different.
Nope.
And even when you go to an Italian restaurant and the whole family's Italian, I don't know if they're doing American Italian or whatever, but it's not as good as Italy. Thank you for your time, ladies.
Thank you.
Okay, bye-bye.